Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking about the Turp procedure. So this stands for Transurethral Resection of the Prostate. So this is used to treat an enlarged prostate caused by BPH, which is benign prostatic hypertrophy, which just means enlarged prostate. Your prostate has gotten larger. And the reason people have this procedure is because when the prostate gets bigger, it causes pressure on things like your bladder, which causes a lot of uncomfortable and inconvenient signs and symptoms. So those problems that people experience can be things like urinary frequency, nocturia, which is getting up at night and going to the restroom, urgency, so as soon as you feel the urge to go in the bathroom, you have to go to the bathroom right now. Frequent UTIs, difficulty starting your urination, or you keep starting and stopping while you're trying to urinate, and then incomplete bladder emptying, that feeling like even though I've just gone to the bathroom, it's not empty, there's still more in there and I still need to go. So a lot of men report these problems, usually after they get a little bit older, because of BPH, and this procedure is one of the most common things done to treat this. So that's what this video is about, this procedure, how it works, because it is so common. Now let's talk about how to prepare. What do you need to know before surgery? A few things to know before the actual procedure. So several days before your procedure, the doctor will recommend that you stop smoking, and they might have you stop any medications you're taking that can increase your bleeding. So things like warfarin or aspirin, things like that. So make sure you do these things prior to the procedure. And just like anything else, right, you want to be in PO the night before. So how does the procedure work? So first, they're going to give you an antibiotic. This is prophylactic, so you don't get an infection. And they might do it either under general anesthesia, where you're completely unconscious, or they might choose to do spinal anesthesia. That's going to be dependent on the individual. So they're going to use a tool called a resectoscope, which I think is a fun name for this, because it resects. So they're going to use this tool. This contains a light, a camera, and a wire loop. And it's a thin metal tube. And what they're going to do is insert it into the penis. There is going to be no external cuts in your skin. So it's going to be inserted into the penis until it reaches the prostate. Then the wire is electrically charged. So the electrically charged wire is what they use to cut away at the prostate bit by bit. So little small pieces is what they do. So the cut tissue in the prostate gland with the wire loop starts to cut it into little pieces, and then irrigating fluid helps flush out those pieces. And this whole procedure takes about an hour to about an hour and a half. So not too long of a procedure. Now let's talk about after the surgery. What do you do in recovery? After the procedure, you're going to be in recovery, and you'll stay in the hospital usually 1 to 3 days after. And what's going to happen at that time is there's going to be a catheter that's in place, and it's going to be doing that irrigating. So the nurse will monitor this. This is something called CBI, continuous bladder irrigation. And the point of this is to help reduce inflammation in that area and to help get any potential blood clots out of the area, which could cause bladder spasms, which could cause pain and more issues that you don't want to have. So continuous bladder irrigation is the common setup after the procedure, and that involves 2 very large bags of fluid and a special catheter that has 3 lumens. So 1 for the balloon to keep it in place, 1 for the water to irrigate, and then 1 for the urine and everything to come out. So how do you know if you're doing well? Usually right after surgery, your urine will look red. It'll look like Kool-Aid. It'll look red. And then after a while, it'll start to turn like a pinkish color, like a pink lemonade. That's how you know you're on the right track. That's how you know you're doing well. So usually after about 48 hours, the nurse will remove the catheter if you're doing well, and they'll see if you can urinate on your own. It is normal to have pain on that first urination. But if you can urinate on your own, that's great, that's good, you're doing a good job. If you're not able to urinate on your own, That's pretty common too. That happens to lots of people. We're going to have to reinsert another catheter, and you might go home with this catheter and you're going to use a different bag. So you're going to use something called a leg bag, whereas a regular catheter bag, like a Foley catheter bag, is about this big. A leg bag is much smaller and it can attach to your leg and you can hide it under your clothing. And you'll wear that for a couple of days until your next physician's appointment, and hopefully they will remove it in the office. Some important discharge education we want to give to our patients include things like drinking lots of water, following a high fiber diet, or potentially using stool softeners because defecation could be painful after this procedure and we don't want them to get constipated. If they're having pain, they can treat it as needed, usually using over-the-counter type medications. Avoid heavy lifting or strenuous activity for 4 to 6 weeks. No sex for 4 to 6 weeks. Monitoring for signs of hemorrhage, so letting them know bleeding too much. That's not normal. We don't expect that. That's not common. And then have them call if they're experiencing anything like fever, pain with urination, they're not able to urinate at all, or if they're noticing an increase of blood in their urine. By this time, by discharge, this should have slowed down or stopped. So if they're starting to notice it pick back up again, they need to call. Just like any procedure, there are risks involved. So the big risks related to the Turp are temporary urinary issues, especially right after we take out the catheter. A lot of people report painful urination or hesitancy. That's common, we expect that, but usually it's only temporary. People can report getting UTIs, erectile dysfunction, but that's pretty rare, it doesn't happen very often. Heavy bleeding, retrograde ejaculation. So when you ejaculate, instead of the semen leaving your body, it goes to your bladder. Incontinence, so incontinence of urine. Urethral strictures, which is like the narrowing of their urethra, which can cause other urinary type issues. And then something called Turp syndrome, which is what we really want to avoid. So Turp syndrome is caused by too much fluid. So when we do the irrigation, right, we're trying to prevent blood clots and bleeding too much, but sometimes too much fluid is absorbed into the bloodstream. And people can present with nausea, vomiting, dizziness, headaches, hypotension, or they can be disoriented. This is a big problem. We do not want the patient to have Turp syndrome, because if we don't do anything about it, if it's left untreated, it can lead to seizures and even a coma. So our nursing interventions include things like stopping the irrigation, right? It's causing the problem, so we need to stop it. Administering diuretics to pull off that fluid. Maybe instead of stopping the irrigation, they might want to switch the irrigation to the use of normal saline, so it has a little bit of sodium in it. And we want to monitor the patient's I&O, their vital signs, and their level of consciousness. And then we want to assess for pulmonary edema, so cardiovascular assessment, respiratory assessment. That's the priority here. So hopefully this doesn't happen. And if it does happen, this is what we need to do about it. Even though this video was about the Turp procedure and it is very well known and very commonly done, I just wanted to point out there are some alternatives. This isn't the only option for patients who have BPH. So there's these two, which involve lasers instead of that hot electric wire. There's the prosthetic urethral lift, which is like an implant that they insert to help lift the enlarged prostate off the bladder to help with symptoms. And then there's the TUIP, so very similar, right? And instead, this is for incision instead of resection. So I just wanted to point out there are alternatives. These are all considered less invasive, and they are becoming increasingly popular. So that was my video. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.